Well, the Housing and Community Secretary, Robert Jenrick, is with us this morning. Good morning to you. Thank you for joining us. How did you decide, as a government, which tiers people would be in?
Well, the scientists advised us that there were 5 tests. They include things like the rate of infection in any particular area, whether it's rising or falling, the rate amongst the over 60s, the people who are most likely to get seriously unwell, and what's going on in local hospitals. And using those 5 tests, we looked at all the different local authority areas in the country and came to a balanced judgment for each one as to where they should sit within the tiers. And that's what the Prime Minister set out now, which, of course, subject to the vote in Parliament, will be coming into effect next week.
How did places exit lockdown that were in a higher tier, thinking particularly of, say, Liverpool?
Well, the tiered approach that we had before the new national measures was working. I think most people would agree it's the right approach to take a localised, proportionate way forward rather than trying to have blanket lockdowns across the whole of England. But we did learn from it that the tiers were probably not strong enough to have the desired effect. So Tier 1 was having some effect. It was slowing the rate of infection, but it wasn't really bringing it under control. Tier 2 was flattening the rate of infection, but in many parts of the country, that wasn't clearly bringing it down. And Tier 3 was having an effect in most parts of the country, although not all, but not as much as one might have wanted to see. So I think if you want the tiered approach to continue, which we certainly do, you need to be sure that it's going to work and that it will work in most parts of the country. And so following the advice of Sage and the Chief Medical Officer and his team, we've designed the tiers to be slightly different to the way they were before, so that we can have much greater confidence that they will succeed and that the battle should be about de-escalating from those tiers rather than playing catch-up and seeing places rise up the tiers in the future.
So why can people in Tier 3, was looking in the paper this morning, people in Tier 3 can drop their kids off at school, go to Primark, do some Christmas shopping, have a workout, get a haircut, go for a swim, but not go to a restaurant? What's the logic behind that?
Well, because these are judgments, aren't they?
But what's the judgment call behind that?
Well, the judgment call is that we want to prioritise education, and so taking your kids to school, ensuring that they can stay in face-to-face education is just incredibly important to us all as parents, as a society. We want to ensure that people can stay and work, although if they can work from home, they are strongly advised to do so. But if you can't, as many people clearly can't, if you work in manufacturing, agriculture, food processing, then you should and can continue to go to work. We want to ensure people can continue to get the essentials of life by going out to the shops. We think hair and beauty is very important to people's mental health and general well-being. I think we'd all agree with that. So there are difficult choices, therefore, as to where we can reduce the rate of infection. And some of those settings, particularly indoors, where you are meeting people in a social setting, are the sorts of places one would look sadly to try to retrench and reduce the rate of infection. And that leads us to the hospitality sector. None of us do this, with anything but a heavy heart, because we know how difficult it's been for all those local business people in our own areas and neighbourhoods over the course of this year. But it is a way of reducing the rate of infection, reducing the social contact that we have with others, and therefore protecting ourselves and the wider community.
So extra funding then for Tiers 2 and 3?
There is funding for them. So for the businesses, they have the business grants the Chancellor has announced in the past. We've provided every local council with funding for discretionary business support schemes, and many of those support schemes have only been launched in the last 2 or 3 weeks, and so there's enough money available for at least the coming months to support businesses. The furlough scheme, of course, continues to the end of the financial year, by which time let's all hope that we're in a dramatically better position. That's when we're approaching Easter, when the CMO and others think that the vaccine rollout should really have taken effect and we can be looking to move into better times. And then for local councils, which I'm responsible for, there's also further support for them. So we're providing them with more money so that they can invest in local community testing, targeted testing of particular settings, like
really
care homes.
Isn't it? Yeah, mass testing is all important, as we saw with Liverpool, which is why it came down, to all intents and purposes, from level 3 to level 2. How do you decide who gets that? Does every local authority have an opportunity? Do you have to be in Tier 3? Do you need to apply?
Well,
what if you're Andy Burnham? Are you at the back of the queue?
No, absolutely not. Every local authority is being given lateral flow tests to do targeted testing. That's, as I say, testing, say, of particular workplaces where there might be a particular risk, care homes, schools, universities. But those places that are in Tier 3 now have the opportunity to do the same as Liverpool did, which is to do mass community testing. And so we're asking any local authority in those places to come to us, say if they'd like to be part of that, and then we will provide them not just with the tests, but with the expertise, the support, the things we've learnt from the Liverpool experience, which, as you say, was very successful, and with military support as well for the logistics. And if all of the country that's in Tier 3 wanted to do it, then we would work on a priority basis. But certainly the councils that have approached me so far, Kirklees, for example, in West Yorkshire, who said they'd be very interested, we're working with them now at pace to try to get them the resources and make a success of it. I think it was one of the sort of arrows in the quiver of Liverpool's success. They used this very effectively. We'd like to see the same happening in other parts of the country.
How quickly can people come out of their tiers? It depends who you talk to. Is there a possibility, let's use Greater Manchester as an example, that they can come out of Tier 3 into Tier 2 before Christmas?
It certainly is possible. There will be a review point in 14 days' time, around the 16th of December. So at that point, we, advised by the experts, will look at each local authority area in the country and see whether they should remain in their existing tier or whether there's a potential to move down the tiers. There are a number of places which were quite finely balanced judgments, where they were on the cusp of different tiers. So those are the places which are perhaps more likely to be in that position. But we've also got to bear in mind...
You don't expect to see some movement then, do you?
I think it's possible, but to finish my point, we've also got to bear in mind that there will be an opening over the Christmas period, which is likely to drive some higher rate of infection as some people choose to go and meet family and friends for Christmas Day and the days surrounding it. And so we have to bear that in mind. Our overall approach is trying to ensure that the tiers hold the line and that places are in a process of de-escalation. What we don't want to do is ease up too quickly and then find that in January we're having to put tiers back in place again. But there's every reason to believe that places could see a change at the 16th, 17th of December mark.
Of course, you have to get all of this through Parliament, and there are a lot of rebels, as you know, 32 votes against, 2 tellers last time as well. There may be more this time, not least from Sir Graham Brady, who is the chairman of the Backbench 1922 committee, as many of my viewers will know. If there are more and Labour vote against you or abstain, you're not going to get these through anyway.
Well, look, we have a job to do to speak to and convince our parliamentary colleagues. It doesn't surprise me that Conservative MPs are particularly concerned about these measures. Conservatives, by nature, want to support people's individual freedoms, want to support small businesses. So these measures are things we do with a really heavy heart. None of us, from the Prime Minister downwards, want to be doing this. But we do think a strong tiered approach, which enables a localised, proportionate way forward, is infinitely better than the alternative, which is to have further national lockdowns. And also the difference between now and the last time we were debating measures like this, when there was concern in Parliament, is that I think there is now a clear way forwards. There is a clear exit strategy for the country. We've got ever-increasing good news on the vaccine front, both the international ones and our own homegrown vaccines. As a result of that, the question is, how can we steer the country through the months remaining until the vaccine rollout has taken its course?
I'll come to the vaccine in a second, if I may. I just wanted to press you on that point. If you don't manage to get it through Parliament, what are you going to do?
Well, we live in a parliamentary democracy, so the task is to persuade our parliamentary colleagues. Well, if we don't have the votes in Parliament, then you can't implement the policy. That's the way our system works.
So you won't do it anyway?
But we will be working with our parliamentary colleagues to try to persuade them, the virtue of this system, and I think we'll succeed because by doing this, we can keep the virus under control whilst we're rolling out the vaccine, and that is the big prize, isn't it? Ensuring that there isn't another national lockdown and that there's now a fairly seamless process towards Easter time when the country can return to something akin to normality.
You won't be able to implement these changes unless you take Parliament with you. There's no other alternative.
Well, we've committed to there being a vote in Parliament, so that's exactly what we're going to do.
OK. You talked about the vaccine. It's a bit of concern about the Oxford vaccine this morning, not least because of America wanting other tests and some confusion about how effective it is, depending on which age group you're in. Where are we with that? Are we concerned?
I don't think there's any reason to be unduly concerned. I'm not an expert in vaccines, so you're probably better off asking others. But we have now formally written to the body that will independently assess the veracity and the safety of the vaccine to do their work. They'll do that in the coming days or weeks as quickly as they're able to come to a judgment, and then it'll be at that point that, armed with their approval, that we'll be able to start rolling it out.
So there's no concern, there's no reason to be concerned?
Well, I haven't heard reasons to be concerned, but we have to let the independent evaluation happen now. The Chief Medical Officer last night at the Prime Minister's press conference was very clear that although he has seen much of the evidence, the full weight of evidence will now sit with the independent evaluation, who will do their own analysis, decide whether it's right to move forward. If it is, then it will be rolled out.
We're pegging a lot on that vaccine, aren't we? We really need it to work. You mentioned it yesterday. You also said that we shouldn't hug family members at Christmas. Will you be hugging your family members at Christmas?
Well, we're still deciding what we're going to do at Christmas. I've been talking to my parents, who one of whom is in his 80s. My mum's a bit younger. Both have been shielding at different times. And we're going to make a judgment in the coming weeks as to what we want to do. And I think that's what families across the country will be doing. There are rules now. You know, we're very pleased we've been able to agree across United Kingdom legal framework. But that's just the baseline, isn't it? Each individual family will be weighing up, is this the right thing for you and your family based on your own circumstances? Are you willing to take the modest risk that's involved in order to bring family together? And there are lots of different options, from the whole family coming together, at home, to perhaps meeting up for lunch with the windows open or going out for a walk on Christmas Day. So there are different options available, and families will have to use their own personal judgment.
Either way, the dog's involved.
Absolutely.
You saw Mr Sunak yesterday under pressure. You bought a dog during lockdown.
Yeah, well, just before lockdown, actually. Yeah, no, I bowed to pressure from my kids just before, so perhaps Rishi will follow. So
you think you would tell him to get one?
I definitely have already recommended. We've both got 3 daughters, and so I've already recommended to his daughters that they get one.
OK, it's great to talk to you. Thanks very much indeed.